One of the primary challenges in moving drugs from the lab into the clinic is really defining what the clinical development plan and really what is the scientific hypothesis that we're trying to test and is testable. What I find a lot is that the types of questions that can be asked in the laboratory are quite different than the type of questions that can be asked in the clinic. And making sure that we have the right people at the table on both sides of that equation, the scientists who are involved in developing that drug, as well as the clinicians who can really understand the science of it, but also translate how to bring that to the bedside, is really the kind of critical components of making that transition.
The absolute biggest hurdle is money. It's incredibly expensive to do a clinical trial. So you have to really have everything in place to convince people that this is going to work. And yeah, understanding the safety profiles, and all of this happens as early as possible, for sure, because yeah, it even comes from target design, picking your target. In my academic labs, we worked on targets because they were good targets. And the thing about being in industry is they might not be good targets because the level is really high in serum. So that would be a big sink. So that's it. You can't drug it, basically, or you have to think of a creative way around that.
To move a drug to the clinical setting, a big roadblock is, of course, the potential toxicities and complications that it may have because we did not know enough biology. But this is why we have preclinical and clinical trials. They are called trials for a reason. This is where most drugs fail. The more informed the biology and the properties of the drug are, the higher the chance that you will succeed.
I think the main limitation is because of the preclinical and in vivo study are very standardized, and so they don't resemble what is happening in real life. So patients are very heterogeneous, and so what can be beneficial for some patients maybe cannot be beneficial for others. So the main difficulty is to find something that can be beneficial for more patients as possible.